Hi everybody, I'm Karin, the founder of Glowinface, and today I have a very special guest with us. He's Dr. Matej.
Hi everybody, hi Karin.
Hi, so he's a dentist specialized in prosthodontics and actually TMJ problems, right?
Yes.
So today's topic is going to be super interesting one, as we are going to talk about TMJ problems, which means pain in the jaw and tension in the lower part of the face. Also grinding with our teeth at night and just like not feeling comfortable in this area. He's going to tell us more about that, and just to keep focused, I have my questions written here so we really can stick to the topic, and you are going to be able to explain everything I have to, yeah. Okay, so before we start, what is prosthodontist?
Okay, prosthodontist is a dentist who is highly trained to treat problems like replacing the missing teeth, jaw structures. We are also very trained in cosmetic dentistry, dental implants especially, and we are also so very highly trained in dealing with the temporomandibular disorders, problems with temporomandibular joint.
Okay, great. So you're actually specialized in this topic, and this is why I wanted to really, invite you here and talk about this problem, because as a face yoga teacher, I really see like a lot of people coming in, and saying they feel pain in the jaw, they have tension there, and if face exercises and massage can help. We're going to explain you today about that too. Okay, so let's start with the first question. What causes pain and tension in the jaw?
Okay, at first I would like to explain one thing, that temporomandibular disorders, is disorders about the temporomandibular joint, but we in this group also muscular pain and facial muscular pain also belongs to the temporomandibular disorder, because this is a very highly interconnected. Okay, what caused these problems? Okay, today, especially in the big city life, today the tempo of life is very quick. We have a lot of stress during the day, and this stress produces a lot of emotional tension, and we release this tension in one very unexplained thing that we doing the clenching and grinding with our teeth. So this produces very high activity, which is completely different in a quantitative and qualitative way, like normal contraction, and we have a lot of high frequency contraction, what produce muscular fatigue. What happens with muscular fatigue? We get a lot of metabolic products like lactic acids, and this produces the muscular pain, because also muscular fibers is not stretched.
Yeah,
it is
it's
contracted.
Always tense and contracted.
And with the lactic acid, we have an acid environment in the muscle, we get also higher contraction, and we feel this like the pain. It is similar if you too much work with the one kind of muscle, you get a pain.
The similar pain.
Yes.
Okay, and what would you say, how many, like in percentage, how many people deals with this problem now in all over the world? You
will shock now. In a big city where we have a very quick life, this 80% of population have these problems with temporomandibular joint.
So that's...
which also belongs here muscular and facial pain.
Yeah, so that's quite a lot. And just to tell one thing more, right, the jaw is always, super connected also with the neck, with our shoulders and our posture, right?
And our back.
And our back. So a lot of times people who have problems in the jaw,
they have many times problem here in the back.
Yeah. So it is all super connected, and also when we are doing the exercises and massages and so on, we also have to really make sure that our posture is great and good, right? And that we sit straight and our head is lifted, because it all is connected.
And what is also very important when I'm doing very good workout is the stretching.
Yeah, super important stretching.
And now we will explain that.
Yeah, a bit more about that. Okay, what are the symptoms and when you feel them most?
The most typical symptom is a tension and a pain at the morning when we wake
In the
up.
morning when we
And
wake
with
up.
limited opening. And one very typical pose of these people who have a lot of facial tension is that they feel pain here and they touch this muscle and doing like that. Because they have a limited opening. They open twice time and they get to stretch this muscle.
Okay.
And they can open more mouth. That is a very typical symptom. Is the morning is limited and painful mouth.
Okay. How do you treat this problem as a dentist specialized in TMD?
I am one of the few dentists on the world who also introduced the muscular exercise, massage and exercise for this muscle. I explained before why I this recommend.
Can we repeat? Why is it so important to do the massage and exercises if you have this problem? First, because we actually start stretching.
Induce especially blood perfusion, blood circulation, yes,
and lymph circulation too,
lymph
right?
circulation, which then carry away these metabolic products which produce pain in the muscle. That is very important to understand.
Okay, great. And then also for stretching the muscle, because if the muscle was tense, we have to stretch it out,
yes,
right?
Yes.
Yeah, and also to actually then build the muscle and gain control over the muscle, meaning that then, we are able to move it in, with our minds to not uncontrolled movements.
What I would like to add, that the self-control in bruxism is a very important thing. We always say the patient, if they can, they find the moment when they clenching and gritting with it. Because we have also two types of bruxism. Daily bruxism, which is more harmful than night bruxism.
Okay.
Daily bruxism happens during the day. It is, we cannot, it is, how to say, it is not in our mind. We're doing this
unconsciously.
Unconsciously, yes.
So we are, for example, we chewing
have a
gum,
stress situation, and we do
clench.
And if you have a self-control, you will find many times that you're doing like that.
And then you are able to relax it more, right?
Yes.
So for example, a daily bruxism, clenching. And then what about, let's say, if you are super stressed, we start to grab for a gum, let's say, and start chewing the nails.
That is the also other part which also produce masticatory muscle pain and facial muscular pain is the parafunctions. The bruxism is also parafunction. We said that is the parafunction which include tooth contact. Then we have a parafunctions without tooth contact. Here we have a nail biting. Many people in stress situation
nails.
Biting the nails, biting the lips, very common. Biting the devices like
the
mobile
remote.
devices, pens,
Yeah.
and this also
Chewing
producing uncommon muscular contraction because these contractions have a much more higher frequency than normal contraction and they produce more metabolic products than normal contraction, and this is the problem.
Yeah. Okay, interesting. And how do you treat the problem, as a dentist? So if you would not be focused on the exercises and massage techniques, which you can do them at home, they are super effective and quick. What are the different options to deal with,
Okay, my treatment plan is I always make the very, very precise diagnostic analysis. What is the consequence, how high the consequence of bruxism are, because that is a very important. At a younger population, we have only problems like tension in a muscle, but in a patient who have a more long bruxism period, they have also problems in a tooth. They get the worn dentition, and worn dentition what produce that we get an improper position between the upper and lower jaw. We have here orthopedic problem, and this also cause more damage to our temporomandibular joint, and also the muscular pain get forced.
So
because we have an improper position.
So you as a dentist, as a regular dentist, you mostly treat it in the way that you actually repair tooth, right? But it's not the...
It is also a problem that general dentists, many times they don't
Even see it.
see this problem because they don't talk very good with patient, and they send to prosthodontics to restore to this worn dentition because restoring the worn dentition is a very complex procedure. And we restore, but with restoring, we only restore the consequence of bruxism.
So we didn't solve
but we
the
cannot,
problem.
but we don't solve the problem. We have two problems here. Functional problem is the muscular pain, problems with the temporomandibular joint, and we have a dental problem that is the worn dentition. But what is the biggest problem? That we cannot treat the bruxism because the bruxism is a psychologically induced. So we have to deal with two problems: functional consequence and dental consequence. And also many dentists, especially also prosthodontists, they give the patient the occlusal splints. Occlusal splints is not treatment for bruxism. Occlusal splints can only prevent
the wear out.
to wear out the dentition, and also restore the position between the upper and lower jaw. That is the most common treatment from dentists, that they put the splint. But with splint we also have a on-off situation, because during the eating you will put out this splint, during the talking you will put out this splint, so we had an on-off situation. So for a patient who have a worn dentition, it is more important to restore this dentition and then start with the exercise. With the patient who have a problems without worn dentition, they must they have to do exercise, massage and exercise. To what we said, to improve this circulation and carry away these metabolic products.
Okay, so actually your opinion and what would be the solution for this problem, let's just repeat. So the first thing is, this is like the mental issue actually, right?
Yes,
the emotional issue and stress, you know, we are all coping with. So we have to start relaxing our minds and our muscles, right?
Yes.
And the best and easiest way to do that is by doing the exercises, massage.
Yes.
And if you have really, you know, big problem with your teeth already, you really have to get and restore, you know, the problem, and then start from actually there. In your opinion, what is the best time to do exercises and massage, you know, if you have these problems?
My opinion, to start immediately with exercise, because when you solve the problem which produce the pain, because worn dentition don't produce the pain. The pain is bigger from muscle. What is also interesting, that this pain can come everywhere.
Yeah. So you can have a headache.
Yes, you can have a headache. This is the most common, and also unexplained problems in the ears and around the eyes. It always belongs to the bruxism. Last studies present that unexplained pain around the eyes and around the ears belongs to the bruxism.
So which part of the day would be the
and
best?
And also unexplained migraines, headaches is also biggest problems. That is the problems if we don't treat bruxism for a very long time. Chronic headaches, chronic pains around the eyes, chronic pains in a region around the temporomandibular joints, earth, and.
So when would be the best time in the day, during the day, to do the exercises? In the morning, evening?
I recommend to start with this exercise at the morning.
Okay, why? Because, you know, after grinding and, you know, clenching all the night, it is good to just stretch everything out.
Yes,
right.
Stretch and start the day with a relaxed muscle. We can also repeat this muscle twice per day. You can also repeat it at the night also. In
the evening, before bed, because you are trying to relax the muscles, you know, before already, you know, starting,
and this
you know, going to bed.
Takes very long time also.
Okay, Cool. And so with everybody who is dealing with that problem, me as a teacher, so face yoga teacher, I would highly recommend, and also you, right?
Yes.
Highly recommend doing face massage before face exercises, because we really first have to, you know,
reduce this pain and release this tension.
The tension, and prepare the muscle for a workout, and then start with static exercises, which are actually, you know, containing slow movements and more of a stretching than, you know, super fast movements where you are, you know, building the muscle.
Because that is a very important, because if you're using muscle in very high frequency, what is very common for bruxism, you have this muscle fiber to position properly. Because when the muscle is fatigued, we have fibers which are improperly positioned. So we have to stretch and properly position to get a normal workflow of our muscle.
Yeah. Okay. So thank you so much, Matej.
Thank you for the invitation.
I hope you found some interesting information, and I hope, you know, you got something to learn more about and so on. So if you feel pain, you can already start doing a massage and training your facial muscles.
Please start immediately doing this exercise to reduce the symptoms.
Yeah.
When we have a patient with the reduced symptoms, we can then easily restore. If you have a patient with the painful symptoms, it is very difficult to work, because they have a very contracted muscle, and we can
not even open
limited opening.
Yeah, and again, you know, as soon as you start feeling the pain, there is still the time to also prevent the wear out of the teeth, right? If you are waiting for so many years, you are going to for sure see it on the teeth too.
Yes.
Okay.
I will also present, you will post the picture of one case which I treat, one patient with aggressive bruxism, which have a highly reduced dentition, highly worn dentition.
And what you actually can create and restore the tooth, right?
Yes, but restoring is only one piece of treating
the whole
consequence of bruxism.
Great. Okay. Thank you so much, and thank you. And we are going to see you the next time, so next week, in our next video. You can find more about Dr. Matej Kulish. I'm going to post his website down below, and you can find the exercises and massage techniques in our online face workout programs. You are going to also be able to find the link down below. Thank you, and have a nice day.
Thank you. Bye bye.